Good afternoon, everybody. This is Greg Drake with Quantum Advisory Group. Today, we're going to be talking about why health insurance matters, especially for the self-employed. A little bit about myself and my company. Uh, we've been in Vegas since 2011. My wife in 2012. She's been doing health insurance since 2005. And I dabbled in insurance back in 2006 and got more into it in 2014 to present day. We started Quantum Advisory Group 2019, just before the pandemic, and we've been striving ever since. And I haven't looked back because health insurance or insurance period is something that I enjoy doing. We take pride in doing and have developed a love for helping people with their insurance, understand how it works because people say it's complicated. So as we get started, I just want to first put this out there because this is very important. In January of this year, 2022, they passed a bill called the No Surprises Act. And as you see on the screen, it says it protects people covered under group insurance and individual insurance plans from receiving surprise medical bills when they receive most emergency services, non-emergency services from out-of-network providers and at in-network facilities. So that's very important because before you wouldn't know what you were getting. And as this says, and look below, I have the link that you can take a look at right here. It tells you about it. And so having No Surprises Act is very important for us as a consumer. With that being said, let me back up. You look at where it says group and individual insurance plans. So everybody who has an insurance plan through their employer, or if it's through the individual Nevada Health Link or Federal Marketplace, you can no longer be surprise billed, which is a true blessing. Number one, we're going to take a look at is one of the top reasons is to have health insurance is to minimize the cost of unexpected medical bills. You just never know when you're going to get a medical bill. You never know when life is going to happen. And according to Peter G. Peterson Foundation, the U.S. Has some of the most expensive health care in the world. We all know that living here in the United States that our health insurance, our health care system could use a little makeover, but for right now, it is what it is. The National Health Expenditure Account estimates the U.S. spending on health care increased by 4.6% in 2019, up to around $11,582 per person, or $3.8 trillion. That's a lot. Health insurance is very important because, like I said, you don't know when life is going to happen. And when I say life is going to happen, you may get in a car accident, heart attack, stroke, whatever the case may be. It's unexpected. You could be the healthiest person in the world, or so you think that you're healthy. You might not go to the doctor a lot. You go for your annual checkup. They do a little, do your blood work, and they say, oh, everything is fine. And it just might not be. So when life happens, are you prepared for it? Number two, it reduces your risk of bankruptcy. During the 12-month ending in June of 2020, there were 659,881 non-business bankruptcies. According to the United States courts, although the courts doesn't have the data on the numbers filed because of the medical costs, but CNBC reports that the medical insurance plays a major role in more than 2/3 of bankruptcies. Now that's huge, 2/3. No, so just think of it like this: having health insurance won't keep you from having to pay medical bills or visiting the emergency room, but it does put a limit on those bills, helping you to avoid bankruptcy. Most individual health plans have deductibles, co-insurance, co-pays, and out-of-pocket maximums per year. It's key to know those when you're setting up your plan. Number three, having insurance can encourage you to take better care of yourself, taking better care of your health. So here's the myth. It says the myth is that health insurance is only for people who with chronic serious illness, or people who have a higher risk of developing illness or becoming injured. Health insurance is for people who are in excellent health too. No, in fact, buying health insurance plan, if you are in the best health of your life, can also help you stay that way. Under the ACA, most insurance plans will cover pretty much a long list of preventative services according to healthcare.gov. Services fall into three different categories, and those categories are all adults, those for children, and those for women. The preventative care services are free for you as long as you have a plan that covers them, and as you see the provider in the network. One thing right here that I want to make that everybody know about is that under an ACA plan, you get an annual physical for free. Take advantage of it. Most people don't even do that, and that's the problem. When you have health insurance, they're giving you a way to take care of yourself, and a lot of people do not take advantage of that. I tell all my clients, get your annual physical. When I talk to them throughout the year, have you had your physical yet? And sometimes they'll say, no, I haven't done it. Just schedule it. It's free. Go get it done. Your health is your responsibility. So if we don't take advantage of those free services that we have in those plans, then that's our fault. Health insurance is very important. And one thing, health insurance plans all have gaps in it. There are things that need to be plugged in. What I mean by that is, say you get a health insurance plan that gives you the basic. Most people want the basic plan. Why that is, I have no idea. They'll spend money on a car, especially design a house, buy nice clothes, all that. But when it comes to their health, they want the cheapest price with a bare bones plan. Now, if you're self-employed, your job is everything that brings in an income. So when you look at doing a health insurance plan, you need to figure out what happens if I get hurt. Because I don't have group benefits, it's self-employed, you're going to mostly be on an ACA plan, or as we talk about here in a little bit, a private insurance carrier. Now, a private insurance carrier is going to tell you if you have some pre-existing conditions, they're not covered for the first 12 months. The 13th month, they're going to be covered. So you have an ACA plan. Take advantage of all the services that you have. Free of your deductible. Your deductible, your co-insurance, and your co-pays. Say, for instance, there is a plan called a gap coverage, a gap insurance. Gap insurance, depending on which carrier you go with, can be a true blessing because it can offset the cost of those your co-pays, your deductibles, and your co-insurance for in-hospital admissions. So you want to figure out, how do I plug those in to reduce my out-of-pocket costs? Because the bare basic plan doesn't cover everything. It gives you access to a doctor and to a hospital, but you're still going to have to come out of pocket for some of the services. Sometimes you may come out of pocket for your x-rays, MRIs, your lab work. You may come out of pocket for your co-insurances going to the hospital, inpatient care. Most people, I didn't say everybody, so don't push me out there. Most people do not have money set aside to cover some of those expenses. So if you can put in another piece of insurance to cover those expenses, that's a blessing. That's called gap coverage. You also have a hospital indemnity plans. Say, for instance, you're in a hospital here in Las Vegas. They say that you're normally in the hospital for 5.4 days. So if you're making, say, $500 a day, you're in the hospital for 5 days. That's $2,500 that you could potentially be missing out on. Those plans will pay you $500 a day while you're in the hospital. So when you get out, you're not really missing much money. And we all know that when it comes to coming out of the hospital, we're not in a rush to go back to work the next day. Sometimes it may take a while, it may take a week or so to get acclimated and going back to work. So it's things like that, or a cancer policy, or critical illness policy for heart attacks, strokes, cancer, that will plug in, that can help you to recover But let me back up, because those critical illness plans, what they do not do, they don't prevent you from having a heart attack, stroke, or coming down with cancer. It gives you options. So say, for instance, you have a $20,000 policy, you have a stroke. God forbid you have a stroke, and then you're going to be out of work for a while. Now, that money can come in handy to keep your bills paid while you recover. Now, remember, you're a small business owner, so if you're not working, you're not making any money. So you won't need to sit down with somebody who's going to walk you step by step on how to have total protection based on your needs and your budget. So we can always figure out how to cover as much as we possibly can, but just keep in mind, it has to make sense. And nobody wants to overinsure you, but they want to make sure that you're going to be covered correctly. Because when you're not working, you're not making money for self-employed. Now, if you have a business, your plans are pretty much set up. Most times you're going to have the best coverage for you and your employees to make sure that something were to happen, then they will be covered. So, for instance, now your plans that you do have, you look on the screen, it says a few notable examples of preventative care services are cholesterol screenings, screening for type 2 diabetes, HIV screenings, certain vaccines, HPV, tetanus shots, tuberculosis screenings, and there's a list. There's another list that goes along with it. So that's why health insurance is so important. If you think about it, when it comes to health insurance, if your health is not in the best, it's hard to get disability income protection. It's hard to get life insurance, and those are key when building a foundation. Because most financial advisors will tell you need to have your base foundation in place, because if they put anything together for you in your retirement future, if you don't have your health insurance in place, you don't have disability income in place, those are things that will keep things flowing while you are in your plan. If you don't have those in there, they're not really going to work with you. As a business owner, you want to have those same plans in place, because it will help you have money coming in case, say, for instance, you're not able to work. You need to have disability. It's based on your occupation, your height, your weight, and if you smoke, and your health history. So that's why having health insurance is so important. That's one of the reasons that you need to go get a physical every year, because you want to have that life insurance in place. And there are different types of life insurance strategies that are out there, from term policies to permanent policies designed for children, all the way up into your retirement years, that can provide a cash, they're called cash value life insurance policies that can add to your financial portfolio. It all depends on what you want to put in place. But if you're not healthy and you can't get those policies, then you need to look at an alternative way to plan your retirement, and your financial advisor will show you those ways. Also, when people are getting older into their Medicare years, they want to start looking at long-term care, which is extremely hard to get if you're not in the top and you're not in the best shape, best health, I should say. And on the screen now, it says, what can I do if my health insurance premiums are too high? What you can do, the first thing we do, as we're here with Quantum Advisory Group, we're going to see if you qualify for a tax credit. That will reduce your out-of-pocket cost if you do qualify. That's the first thing we can do. And if you're making too much money and you don't qualify for a tax credit, or the tax credit is really small, we can look at a private insurance carrier to help reduce your cost. Number two is you're going to look at getting a high deductible plan. If you're healthy, it might make sense. But that's why sitting down and going over the ideas of how do I reduce my medical expenses or my health insurance costs, because it is kind of pricey. ACA, if you don't get a tax credit, is very costly. Some private insurance carriers, what they will do, if you're healthy, they can reduce your out-of-pocket cost by 40%. I know of one particularly that we use that helps reduce it, but it has to fit what you're looking for. It's a nationwide PPO. You can look at picking the doctors. It allows you to take control of your health care. And that's what most people don't take into consideration, is you want to take control of your health care to control your out-of-pocket costs, because that's your money and your health. So just think about it. And like I said before, looking at private insurance. Now, one thing that I want to talk to you about as well is what the federal poverty level. It sounds kind of messed up, but that's how we look at the ACA. You're between 138% of the federal poverty level up to 400%. And depending on your family size, your gross household income, and if you smoke or non-smoker, that will determine how much you're going to pay for your health insurance. Makes sense. If you're a non-smoker, then you're looking at your household size, your gross household income. Anybody that's claiming on your taxes, anybody in your home that's working, that's on your taxes, you have to count that income. And so if you're self-employed and you're looking at getting the best coverage, you need to sit down with somebody and have that conversation. This is what I got. This is who will need to be covered, and then we work it from there. We're gonna plug in those gaps. You're gonna look at disability. You're gonna look at a gap policy if you can qualify for that. You're gonna take a look at a critical illness policy because you want to get the best protection possible without overdoing it. You might not need $75,000 critical illness policy. You might need just 50. Whatever the case may be, you want to make sure that's a part of your financial portfolio. Health insurance is key. And one of the things that was crazy is that in Las Vegas, I was doing a study to see how much does a broken leg cost? And they said the average cost for a broken leg is $7,500. The cost to start with cancer, it starts out at $100,000. Can you imagine not having health insurance and you needing those services? It hits you in the pocket. It's going to hurt. There's no way around it. And most men would sit there and tell you that I'm okay, nothing's going to happen to me, and then they don't have health insurance and they come down with cancer. They'll have a heart attack. I know a friend who had a heart attack and it cost him $750,000. Can you imagine not having health insurance and having a bill like that? I know people say, well, I'll just file bankruptcy. You wouldn't have to if you have health insurance and you put it in place and then just go from there. I know it could cost a lot of money, but look at ways to curtail that cost by keeping yourself healthy as possible, by going to get a physical and not putting it off, and just making sure that you're in the best shape possible. We got to watch what we eat, and so exercise and stuff like that. And there are life insurance policies that are out there that will give you rewards for living a healthy lifestyle, taking walks, being active a few times a week, and things of that nature. So there are things out there that will definitely help you. First of all, take care of your health with your health insurance. Make sure your life insurance is in place. Make sure your disability income is in place. All three of those are together because it's based on your health. If your health is bad, you might not get two of the three. You might just be able to get one. Then you have to get creative on how to protect you going forward, your family going forward, so that way you don't have to file bankruptcy because you were unprepared. And one thing I always tell my clients, once I get to know them, quit being cheap when it comes to insurance. If your car note is $700 to $800 a month, and I show you a plan that's $400 a month for your health, and it's a complete package, don't bark. Figure out how to make it work. I'm just saying, because your health is very important. And so that's why I am an advocate to sit down with as many people as possible, self-employed individuals with in Medicare, to help you to understand. You need to be thoroughly educated in how the plans work, understanding what a co-insurance is, understanding what deductibles are, understanding when you're going to have to pay that. And if you're not set up, let's build a plan to get you the best protection possible so that when life does happen, and it does happen, go to any hospital in their ER and see life just happened to people. Look at the news. People who've been in car accidents, shootings, stabbings. You just never know when you're going to need to have that health insurance in place. And I guarantee you that the care that you receive is based on the insurance that you have or don't have. It's huge. You can go to an emergency room. They'll get you patched up enough to send you out the door. Can I prove that? I don't want to tell you to try it, but it happens. I've heard stories that when they didn't have the health insurance, they got them well enough to get them out the door and to take care of the ones who have health insurance because they know that they're going to get paid at some point. So that's why I'm an advocate for health for everyone, especially business owners, because you got too much to lose. If your income is based on your ability to be able to work and provide an income for your family, and you're running a business, you need to have that health insurance right in place. And everything about it: health, life, and disability. You can do ancillary products like dental, vision, all that. That plays matter of fact, dental is a key part to your overall health. Something about your oral, you said the oral health is related to everything in your body as well. So, my name is Greg Drake. My information is on the screen. I'm the president of Quantum Advisory Group. If you have any questions, I'm here to answer. And I don't see any questions. All right. If there are no questions, I will definitely thank you for your time. And it's been my pleasure. My first webinar. And if I sound messed up and all over the place, I apologize. But this was fun. I want to look forward to doing it again. Thank you. Oh, wait a minute. Oh, before I back up, there are alternative plans to the ACA. The first one is you can look at a defined benefits plan, which means that they'll pay a defined benefit, but you normally need to be in pretty good shape, no major pre-existing conditions, and you can get that, and it's going to save you about 40% on your health insurance in most cases. I've taken a family who were paying close to $2,000 a month, and they were all pretty healthy. Looked at a defined benefits plan, went over it line for line with them, and they ended up only paying $1,000 a month as opposed to close to $2,000 a month. And they were able to take that money and put it somewhere else in the financial portfolio. And their financial advisor was happy that I was able to show that to them, and it fit their situation, and they understood it clearly. Asked a lot of questions. It took me about 2 weeks to get them to pull the trigger, but it worked. Gap insurance policies. So, say for instance, you have a high deductible plan. Your deductible right now says $8,700 a month deductible. Your out-of-pocket cost for the year is $8,700. A gap plan will say, hey, if you are in a hospital or you going into a hospital or outpatient surgery services, a gap will cover 50% of your medical costs. For outpatient services, will cover up to the $8,700, whatever mark you have for your your out-of-pocket cost. It will cover all of that, so that way you don't have to come out of pocket. So your doctor visits, say you have a copay of $50. With a Gap card, that will cut it. They'll take it to $25. If your MRIs, say are $800, it's gonna cut it into $400. Things of that nature. It can cut it in half, or if you were to get put into the hospital, it'll cover, if it's set up right, it will cover your full out-of-pocket max. Then your insurance company is on the hook for your medical care at 100% for the remainder of that calendar year. Young adult children are covered on the parents' policies up to age 26. And when they age out, they have 60 days to find healthcare coverage on their own. Or if they're not really working, they're in school, they can look at getting into Medicaid through the state. Here in Nevada, they're able to do that. So once the person turns 26 on their parents' policies, they have to get off their parents' policy onto their own policy. And if you're in college, one of the best things, if you're in a state that has the ability to get Medicaid while you're a student going to school, I would suggest it. That's where you can keep covered no matter what's going on in your life. So you don't get those bills that you were just guessing at. Yeah, every insurance, everybody that's approved for insurance in the state of Nevada or through the federal marketplace, particularly in that particular state, they all have to abide by the same rules. They have to provide all the same coverages because there's 10 minimum essential coverages for an ACA plan. Now, the private insurance carriers, they do not have to abide by the ACA because they're private and they can exclude something that they don't care. Like some private insurance companies will not cover pregnancy. They will not cover mental health. The ACA, they have to cover those the pregnancy and mental health and things of that nature, where private insurance companies say, no, we're going to pick and choose what we want to cover, what we'll accept, or make you wait a year or so to have that coverage. And one more question. One thing I do recommend, Steve, perfect. I do recommend, if you can get a gap policy and you get a high deductible plan, you will not be sorry that you did that. I promise you. And if you have children, accident policies are key. And you're self-employed. So if you have say for instance, it's a mother with just with some children, and she's a business owner. So she's running a business and taking care of her kids. The last thing she wants to do is miss out on money, but she's going to take care of her children. That's first. So if I can just put her in a policy with an accident with her children, because our children, I used to jump off the roof. My mom used to get mad. She said, "Get off the roof," and I would jump off. And she'll yell, "I didn't mean it like that." Or she'll get out of that tree. I'll jump out of a tree. So kids are going to be kids. If you don't have an accident policy, you need to look into getting one, get educated on the different carriers to see if it's a good fit for your family and if it's within your budget. But the gap is a must. If you qualify for a gap to protect your family, you will not be sorry. Once again, my name is Greg Drake, Quantum Advisory Group, and I approve this message. Have a great one, folks.